Hello, everyone, and welcome to the Aesthetic Medicine program at Queen Mary University of London. I am Dr. Bashar Shatta. I'm one of the tutors on this program and one of the module leads. I'm just going to take you through what this program has to offer you if you choose to join us. First of all, the Aesthetic Medicine program at Queen Mary is a distant learning program. Most of it is delivered online. You have three pathways to choose from. The first one is Master of Science, which is basically a 2 years part-time program. And then you have the postgraduate diploma, which is again, it's a 2 years part-time program. And then you have the postgraduate certificate, which is only 1 year. Again, it is part-time. Now, who is this suitable for? Mainly doctors, dentists, and nurses who are practicing aesthetic medicine or wants to start practicing aesthetic medicine. So this program is designed specifically to provide clinicians with the core knowledge and the core skill that they need to practice safe and effective aesthetic medicine. It is a unique opportunity for clinicians, especially who are based in the UK, but also international, to learn more about aesthetic medicine and the involved skills. It does provide the knowledge and the foundation for a safe practice and evidence-based practice in the aesthetic medicine field. Now, why do we think that you should take this course? First of all, it is the first of its kind in the UK, being a distant learning with contribution from international faculty, as well as having international students part of this program. It offers you flexibility. It's part-time. You can study anytime. You can go to your modules at any time you wish and complete the work that is required at your own pace. You can also take part in optional simulation training. Just to make it clear, this course only offers simulation training and workshops, and that usually happens at least twice a year. It is important to know that this is based and run from one of the largest cutaneous research centers in Europe, the Center for Cell Biology and Cutaneous Research at the Blizzard Institute. The other thing from this course, you will actually learn a lot about evidence-based practice, not only in aesthetic medicine, but in all, it is actually relevant to all fields of medicine. You will have a thorough knowledge of the relevant clinical anatomy and physiology. You will build a solid foundations, basically, in aesthetic medicine and the management of aesthetic patients in general. And you will be able, by the end of it, to critically analyze literature relevant to aesthetic medicine and take your analysis and your conclusions from that into your practice. Just briefly to mention about the structure of these courses. So for the Master in Science program, you will have 8 compulsory modules. They are partially taught and partially self-taught, if you like, and they are assessed with multiple choice questions and also an assignment of about 2,000 words. You'll have end of year OSCE exam, usually happens in May, and that is for each academic year. And for the Master of Science program, you will also have to complete a 15,000 word dissertation where you'll be able to do proper academic writing, and will be encouraged to publish and do some research in the field of aesthetic medicine. For the postgraduate diploma, it is very similar to the Master of Science. The main difference is that you won't have to complete the 15,000 word dissertation. The postgraduate certificate, some people don't want to spend 2 years, want a shorter course, so this is more suitable for that. It's only 1 year. You have only 4 modules to complete. In a similar way, they are assessed with multiple choice questions and 2,000 word essay for each module. You'll still have to do your end of year OSCE for that academic year. And finally, the entry requirement for these courses. So as a doctor or a dentist, you need your medical or dental degree. It has to be recognized by Queen Mary University of London. For nurses, you need a nursing degree rather than a diploma. Also, as a nurse, you do need to be registered and a practicing nurse with a minimum of 4 year working experience. It doesn't have to be in aesthetic medicine. One of the desirable criteria is that you are prescribable, but it's not essential at this moment. And we hope you join us, and hope to see you all soon. Thank you.
Hello, I am Dr. Vanya Hiretsuka Dalmida, one of the clinical lecturers of the post-graduation course in aesthetic medicine. I am also the lead for clinical days and external engagement. I lead Module 1, and I am one of the contributors for Module 2. I would like to take this opportunity and just give you a brief introduction of the topics that are going to be covered in Module 1, which will last 6 weeks. So we're going to start with an introduction of a history of aesthetic medicine before delving into skin anatomy, stem cells, wound healing, and scar management. My contributors for this module are Dr. Rudun Madada-Nikaru and Dr. Frank Gamma. So together we've been preparing webinars. They are going to be delivered weekly with topics that we'll be studying. In addition to that, there will be one specific webinar for on how to write your first academic assignment of this course. So this module will enhance what you already know, but will act and serve as a base, as a solid base for your future modules. This module has been fully updated, so we have new material, new recommendations, new references. So I'm very excited about teaching it, and I really hope that you'll be able to join us in this journey. I am aware that applying for a post-graduation course can be quite daunting, especially when we do not know what to expect in terms of commitment, as most of us are full-time clinicians. So of course, self-discipline and self-motivation are paramount if you want to succeed. But please be assured that we are here to provide you with support throughout the course, whether you're familiar or not with academic work. So thanks for your time today, and I look forward to welcoming you in the next academic year. Thank you very much.
This is what we will cover on Module 5, the first module of the second year. I'm Dr. Sarah Master-Palmer.
And I'm Haider Hassan, and we are your leads for Module 5. This module is divided into two segments: patient psychology and medical legal practice. Surveys show that many aesthetic clinicians feel unsure about the regulations that govern our industry, and few feel confident identifying patients with suspected mental health issues.
The realm of aesthetic medicine has been known to be grossly underregulated in most countries for many years, to the detriment of both patient safety and to the reputation of the industry. However, this is slowly changing, and regulatory bodies and guidelines have been established and are constantly evolving along with the legislation. In the medical legal segment of this module, we will be looking at the UK regulations governing aesthetic medicine, the process of obtaining informed consent, what constitutes professionalism, and what happens in case of a patient claim. The medical legal segment pertains to UK law, but for our overseas students, this information could be put in context with the regulations of the countries where you practice. We encourage our overseas students to think about how the laws differ and where they align.
In the patient psychology segment, we will be looking at factors that motivate patients to seek cosmetic treatments, patient expectations and agendas, underlying psychopathology and self-consciousness, and management of psychologically challenging patients. In addition to the module content, during this program, we will provide you with webinars on related topics where we go a little deeper into specific area. As this is the first module of US 2 of the program, we wanted to provide some additional support with academic writing. So we will cover this in a dedicated webinar in your second year. Here we will cover the principles of academic writing and preparation for your dissertations. We hope that you will find this module interesting and useful in your daily clinical activities, and please don't hesitate to contact either of us should you have any questions or queries about this module. And once again, welcome.